And thank you so much for having me here, Jan, and I'm happy to be here. We are working with City Harvest, so you will hear from Kate next, as she'll be coming in, I'm sure, any minute, about child nutrition reauthorization, New York City working for a unified voice for child nutrition reauthorization, and we're delighted to be doing that. As we all know, and what we've heard already today, is that the really big picture for the child nutrition bill is about feeding and educating children about food from infancy through their adolescence. And what we really want is something that seamlessly brings together the feeding of children and the education and really makes those very strongly bound together. And just to kind of build on some of the things that everybody has said is, when I was working with Tony LaCorey back at the beginning of the Koch program in the mid-90s, we basically did research that really did show exactly what Nancy was saying, is that it was only when the kids cooked the food in the classroom and then saw it in the lunchroom that they actually ate it. Kids that saw these new 13 vegetables and whole grains that we were putting on the menu at least one a day, every day for 5 months, were still throwing away 95%. So just seeing it on the trays did not have them eat it. But when they were cooking it in the classroom, then they were not eating all of it yet, and there was a lot to work on in terms of getting it presented on the lunch tray the same way that it was when they cooked it in the classroom, but they were eating a lot more of it and more excited about doing it. A second thing is that we are actually, with Wellness in the Schools and Edible Schoolyard, doing a longitudinal study at PS7, which is right uptown here, which I hope will give us some evidence about when you do education, what Edible Schoolyard is doing with gardening and cooking, along with having WITS change the menu in the cafeteria, how is that changing how children are actually eating and what their attitudes are about food. So we're the second year in, we did baseline data last year. We did the second collection this year, which was just the beginning of the program. So look forward to more of that after we get to collect more years of data on how this rolls out, and I think that will give us some information. And third, which is just a little thing, I know Tazy's here, right, from New Settlement. We're working with Tazy from New Settlement in the Bronx, and basically some of my students are collecting data on 2 schools that are very near each other, mostly in one school that is very low income, is on actually the express menu, which, as we heard, there was 3 menu options, and this is the one that is really the one that's the most quick stuff to prepare. And most of the children there, the principals know, get very little food at home, so they are really relying on school food for breakfast, lunch, and dinner, and the principals feared that the kids were not eating the food that was served, and what could they do to actually make that better. So we're trying to collect data on that, and then also looking at another school around the corner, which is the New Settlement Community School, which is a beautiful building that has WITS in it, has a beautiful kitchen, and seeing if the kids from the same neighborhood, if that different presentation of the food will help them to eat more. So I'm talking about this bringing together of the education and the feeding of children. So I want to talk a little bit more about the education and just talk about what do we know is good nutrition education. And as some of you know, I work very closely with Dr. Isabel Contento, who has literally written the textbook on nutrition education and looked at decades and decades of research on nutrition education and what makes it effective for changing behaviors. So there's really 3 components that you need to have in that nutrition education. The first is that the education needs to motivate and inspire people. And basically, that has to be for the particular audience. So that's why you really need to work with the community to figure out what's going to be the aha moment for that community that's going to get them to do it. So like for kids, when they get to garden and they get to pull that carrot out of the ground, or they get to cook something, all of a sudden that's going to make that so much more exciting than any amount of talking about, why it's good for you and all of that kind of thing. The second element, so first is to motivate and inspire. The second element of good nutrition education is that it's behaviorally focused knowledge and skills. And that really means that it's giving people the really specific knowledge and skills that they would need to do the behavior. So sometimes it's just, can be as simple as understanding that when you're making a salad at the salad bar, that it's really good to try to challenge yourself to have 3 different colors on there. And that's a skill, right? To know that you're looking for different colors. So sometimes it can be much more complicated if you're cooking food, but sometimes it can be simple depending on what it is that we want to do. And the third element is to have a supportive environment. So an environment that really supports doing the behavior. And that can be actually creating that environment. It also can be making people aware of the healthy options that are there. There's sometimes lots of healthy options that are in the environment that people aren't aware of, just like we did with the Cook Shop program. Then the second point I want to talk about is we really are trying to learn about what's going on with nutrition education in public schools in New York City. And we just published a report on this, but basically what we found looking at the 20 largest nutrition education programs that are pushing into New York City schools, in Brooklyn, Queens, and Manhattan, only 39% of the schools in those three boroughs were getting any of those programs. And then we looked at the schools that were the highest need, so had the highest percentage free and reduced lunch, were in the neighborhoods with the highest rates of childhood obesity, and in district public health office neighborhoods, and they were getting about the same rates only because there was programs that were pushing into those schools saying we're going to only work in neighborhoods with high needs. WITS is an excellent example of a program that actually has a sliding scale model and is both in schools where the parents can pay, and also has ways to work in schools where they would not be able to pay, and so it's a great model to look into. And then I want to talk finally a little bit about how we can actually fit nutrition education into the child nutrition bill. And the first thing is school wellness policies, and that was something that Jan mentioned just briefly, but basically was in the 2004 child nutrition bill, was that all schools had to have school wellness policies, and they had to be implemented in 2006. And they have been an unfunded mandate, as Nancy said, but there was just now, from the 2010 bill, really trying to get regulations that would help schools frame them more and also give them more supports for this. And the comments for that were just due yesterday, so hopefully some of you wrote comments, but also it's going to be an ongoing process. And so I think if we can get more assistance for schools to do these, both by the regulations that are from the federal end, the assistance on the federal end. In New York City, the Department of Education has, through the Office of School Wellness Programs, has wellness councils, and schools can write grants to get $2,000 to help them do their wellness initiatives. Second thing is team nutrition, which is what the federal government says is the technical support and the hub for education. We can hopefully hope to have that be a better resource for across the nation for working with school food. And finally, I think, which has already been mentioned, is the Farm to School program, I think, is really kind of a shining star that brings together procurement of local foods with school gardening with education. So it brings together that feeding of children with the education. And I just want to share, because I was just at the Farm to Cafeteria conference in Austin, and the USDA did a Farm to School census where they asked schools two things. Are you buying locally produced food, and are you teaching your children about where food comes from? And from across the country, 3,812 districts said that they were doing this, which is great, and that represents 38,369 schools and just over 21 million children. So hopefully with the next child nutrition reauthorization, we can really make it very robust and strong and seamlessly bring together feeding children with doing education.